Morning. You guys all right to go? Thanks very much for being here. 27.1% of Victorians 18 and over have had 3 doses, so that number continues to grow. It's up from 25.9% yesterday. This weekend, the Booster Blitz is all about getting that number even higher, and everyone who's eligible for a booster, with the interval now changed to 3 months, going along, making an appointment or going to one of our walk-up sites, getting that 3rd dose and knowing that they've played their part both to protect themselves, the people they love, and to protect those that we all count on, our nurses, our ambos, our doctors, all of those who work in our health system every single day. This really is a 3-dose project. To be properly protected, you need 3 doses. That's what the experts tell us. That's what I expect National Cabinet will reflect today. We'll have to wait and see how that runs. But the notion, I just want to be really clear with everybody, this is not 2 plus an optional extra. It's 3 doses in order to be protected against severe illness, as well as to minimise the likelihood of you getting the virus or giving the virus to someone else. Let's hope that our national framework reflects that practical scientific reality, the challenge we're living with today, in the policy that we have set. 1,424,651 people 18 and over have had a 3rd dose. To give you that in the raw numbers, 22,266 people were vaccinated at state sites yesterday, and just under 5,000 of those were 5 to 11-year-olds, thanks to mums and dads and to our younger Victorians who are going along and playing their part as well, getting a 1st dose, beginning their vaccination protection journey. There are more than 60,000 people aged 18 and over are booked for a 3rd dose appointment at the moment, but there remain 200,000 appointments that don't have anyone's name beside them. They are available. They're there for people to snap up. They apply over the next 30 days, and I'd encourage anybody who is more than 3 months past their 2nd dose, with that change we made yesterday, either having received a letter from the Commonwealth or because of those recent changes, just when they do the maths, it was more than 3 months ago. Please go and make an appointment. Please go and get a booster. Please go and get that 3rd dose. That'll keep you safe and see these numbers stabilise and indeed come down. Plus, of course, protect us against whatever variant is next, and we simply don't know what else is coming at us. The 3rd dose is critically important from that point of view as well. In terms of kids, more than 26,000 children are booked into appointments over the next 7 days, but there are more than 54,000 appointments available over the next 30 days. So just as for boosters, 3rd doses for adults, there are plenty of people booked, but there are plenty more spots open. So again, I just say to parents, I know there were some issues across the system very early on, as is often the case when you roll something out brand new. But there are plenty of appointments there now. It's much easier than it was. It's really important, and thank you again to all of those parents and young Victorians who've gone and begun that vaccination journey. Can I go now to hospitalisations? There's 1,206 Victorians in hospital with COVID. 122 people are in ICU, and 40 of those people are on a ventilator. Sadly, 15 people passed away with COVID, and we send our deepest sympathies and our best wishes to all of their families. This will be a very challenging time for them. In terms of case numbers, 10,273 people self-reported or registered their positive rapid antigen test result. They went to coronavirus.vic.gov.au/report and played their part, making sure that we've got the most complete picture of what's going on out in the community, but also taking pressure off our PCR testing centres, where there is limited laboratory capacity. It's not infinite, and this mix now, where it's about 50-50 in terms of positive results coming through home-based rapid antigen testing and PCR testing where that's appropriate, that is working much better than the very lengthy delays we saw when everybody was going and getting a PCR swab and a test through a laboratory some weeks ago. A further 11,693 people received a positive PCR result from 51,067 results, 51,607 tests processed, 51,067 I should say, tests processed. That gives us a total new case tally of 21,966 since yesterday, and a total active case tally of 246,894. So this is in the community. This is right across our state, right across every state in our nation other than WA, and it's incredibly important that we all play our part. So following those rules, there are not many rules, but they're very important that we follow them wherever we can. Do our level best to follow those rules, that we isolate when we are waiting for a test result. If you had to go and get a PCR, isolate if you're a household contact of someone who has tested positive. I know that there are many hundreds of thousands of families who've had a different summer than they had planned, spending some time away from other people. Many people are doing that right now, and I thank each and every one of them for the contribution that they're making. Your isolation, your sacrifice is not just important for you and your family, it's important, it's critical for every single family, and of course our health family, those nurses and doctors and ambos, taking just a little bit of pressure off an already stretched system. So thank you very, very much for everyone who's playing their part. I know that is not easy, but it's deeply appreciated. Now, in terms of announcements, I'm very pleased today to confirm that we have placed an order for a further 166 million rapid antigen tests. As you know, we had already ordered 44 million and had seen significant early deliveries arrive. 3 million I reported on last week. We've had another series of deliveries totalling 4.5 million this week. That makes all sorts of things possible, and we'll have more to say about the way these tests will be deployed and the environments in which they'll operate in coming days. Indeed, National Cabinet will be talking about some of these issues today. It's very important that we keep adding to that stockpile. They're going to be relevant. They're going to be particularly important in the weeks and months to come. And just like every other state in the country, I assume, and every other country around the world, we're out there in the international market and indeed some local market, pushing as hard as we can to get as many of these as we can, as quickly as we can. We had a couple of flights this week that did not land on the basis, didn't take off and didn't obviously arrive on the basis of the ash cloud. So, you know, there are many challenges, many and varied challenges to continue to build to these stockpiles, but we're very confident that we'll be able to do so. And of course, there is that 10 million, 2.5 million, which will come to Victoria out of the national medical stockpile as well. This is a very significant order that we've placed, among the largest, I expect, across the country. We've already distributed, by the end of this week, we will have already distributed more than 2.2 million rapid tests to our health workers, to staff in sensitive settings, as you'd expect, and also vulnerable communities. And that includes more than 50 community organisations that I spoke to you about a few days ago, them having a rapid test supply, using those proven and trusted networks, allowing them to reach out and provide the best service and care to their communities. That takes pressure off so many other systems and delivers much better outcomes, particularly for those who have underlying vulnerable circumstances. That vulnerability is best dealt with at a local, trusted, most personal way possible. And we saw right through last year and the year before, multicultural communities, multi-faith communities, real community leaders stepping up, playing such important roles. And again, I thank them for their true and genuine leadership at the most difficult of times. We are delivering millions of these rapid antigen tests across the state. So many of our testing sites have RATs available for those who need a rapid antigen test. We are handing out literally hundreds of thousands of these, and Jerome may be able to speak in more detail about some of the trends in recent days, but it's, I'm very pleased to think that there are, on any given day, 40, 50, 60,000 people, perhaps more even, who are getting a rapid antigen test free from a testing hub, and that's about cutting off chains of transmission. When you combine that with people isolating, making that sacrifice, making that important contribution, that's how we limit or at least impact the number of cases that we have across the community. And what we know is a percentage of the total number of cases will finish up in hospital. So if we have less total cases, we finish up with less people putting pressure on our health system through no fault of their own. That's just the way this works. We don't have as many people in ICU as you might have expected if this was a Delta outbreak that had got away this much. That's the nature of this new variant. Not mild, but milder than Delta. The vaccines are still working as a protection against critical illness in the vast majority of cases. That's great news. But infectivity, the attack rate of this, the transmission rate of this virus, this new Omicron variant is so high that the only thing we can do is get a third dose. We call it a booster. It's not really a booster. It's certainly not a bonus. It's critically important. 3 doses is what is needed. And then, of course, to isolate and play your part when you're called upon to do that. We're grateful. It's so important, and it is making a big difference. As we see some stability come to these numbers in recent weeks. Now, I just wanted to speak briefly in relation to announcements that the Acting Minister for Health has made today. We spoke about IVF services yesterday, and I made it very clear to you that no one's pleased to have to turn off or pause any services across our health system. But Code Brown and the extraordinary and unique pressure that our system is under, and again I stress that's not because of money or the lack of machines we need or PPE or equipment, it's about people. And when you have literally 4,000, 5,000, 6,000 people who on any given day would be working in our health system but aren't because of COVID, that puts extraordinary pressure. So decisions were made based on advice. It's now appropriate to have another look in the context of things as they are unfolding. You kind of start with a worst case position and then try and reinstate whatever you can. I'm very pleased that the public health team, the Chief Health Officer, has reviewed his advice and the Minister's accepted that and been able to make a new decision under the new Act to reinstate IVF services. That'll take a couple of days. But those who are already in the system were still receiving, mid-cycle for instance, they were still receiving IVF services. It was about not having new patients come into that system. They'll be able to come into that system from early next week and the orders will be effective immediately, and that is a very good outcome. I apologise for any distress, for any concern. It's never easy. It's never easy in such challenging times, and I just want everyone to know across the community, everyone's doing their very best just to keep people safe. That's what drives us. That's what everyone who's providing advice to the government is driven by, one thing and one thing only: to try and do everything they can to keep Victorians safe. But I do apologise for any sense of distress or pain out of this, but it's great to be able to have those services back on. And I thank the public health team for reviewing their advice, for changing their advice, and of course for the Acting Minister for Health for having made the decision he's made. Now I might throw to Jerome just to go through a few other matters, and then we're happy to take any questions you have.
Premier, good morning. Just want to start with a word to all of our staff who are working across our health services at this really challenging time. Earlier this week I had a chance to meet the team at University College Hospital in Geelong, and you can see again the pressure on all parts of the health service from this current high level of COVID activity. Over 1,200 people in hospital, but also it impacts every single department, every single section of our health services and the very hard working staff who work in there. As at today, we have 3,900 health staff who are unable to work due to either being positive with COVID or caring for others in their household with COVID, but that number is pleasingly starting to come down. That was 4,500 yesterday, and the quarantine exemption arrangements that we put in place with our health services and with other critical industries are now starting to give some relief to those critical workforces and to ensure that people who are able to return to work and stay at work safely can indeed do so. And can I just thank again all of our staff working across our health services for the phenomenal work that they're doing at this most important time and the care they continue to give to literally thousands of Victorians. We're also starting to see, I think, some stabilisation not only in our case numbers but also in our testing numbers. 51,000 PCR results reported today. That number is now fairly stable, with around 50,000 PCR tests being undertaken every day at our testing stations. As a result of that greater stability, and in addition, of course, the introduction 10 days ago of rapid antigen tests through our testing sites, we now have 76 sites offering rapid antigen tests, all PCR tests, and those decisions are made clinically by the team when members of the public turn up. But we are seeing, as a result, around 50 to 60,000 rapid antigen tests being handed out for free every day for those testing sites, as well as 50,000 PCR results being processed every single day by those same sites. The waiting times as a result have dropped, so we're now seeing waiting times well under half an hour on average across our entire network. We are, of course, expecting a little bit of hot weather in the coming days. It'll make it a little bit more cumbersome, but again, we're now seeing a really steady flow through of people through our testing sites, and we're in a far better place than we were a couple of weeks ago. It's also good to see as a result of some really hard work by pathology labs across the state. We're now back to seeing results turned around the vast majority of times by the next day. So 86.5% of test results are now coming back by the following day. That's getting into the zone that we've always been in, the zone we want to stay in. And my thanks to the whole testing teams and the pathology teams for the really hard work. A very difficult Christmas and New Year period, but good to see through the hard work in the background, some tough decisions that were made, but also now the introduction of rapid antigen testing, that we're seeing a more consistent performance and one that will get us through the remainder of this Omicron wave. So far across our 76 testing sites, we've now handed out a total of 722 rapid antigen tests to people, and we expect to see that number continue to grow by around 50 to 60,000 a day. That, of course, is part, as the Premier has said, of around a 2.2 million allocations so far, or distribution so far, of rapid antigen tests, not only through our health services, through our testing sites, but also through some of those vulnerable settings. And we're starting to see those tests getting to some of those really key priority locations. And, of course, we look forward to seeing more shipments arrive in the coming days. Finally, around vaccination, obviously we're really pleased to see the reduction of the third dose interval yesterday to 3 months. So anybody who had their second dose before the 21st of October can now come forward and get their booster dose done. Please check your app with your vaccine certificate. It'll be clear on there when you had your second dose. Use that to ensure to make sure you're ready to get your third dose done. We saw a very pleasing uptick yesterday of thousands of people making bookings, both through the call centre and through our online system. I think we had a 90% increase in online activity and over 100% increase in call centre activity. So great to see thousands of people come forward yesterday to get their bookings made. And we're seeing some really busy scenes at some of our vaccination clinics this morning as people are using that walk-up facility. So please, we've still got 200,000 appointments available over the coming weeks. We'd really like to get those filled, and then we'll make more appointments to ensure people can all get their third booster doses done. If you want to walk up, then please do. Bring a bottle of water, but also check our website beforehand. It'll tell you which of our sites you can do the walk-up at and what the current waiting time is, so you go to the site which has got the most convenient service for you. Finally, in terms of 5 to 11s, again, great to see so many young Victorians getting vaccinated over the last 10 days or so. Great work by our pharmacies and GPs, and a huge thanks to them for the work they're doing, as well as our state clinics. We do have, as the Premier said, 54,000 booking appointments available for 5 to 11s. We've got appointments available in the coming days, and particularly in the next 10 days, for people to get their kids vaccinated before they go back to school. In particular, if you go to the Austin Repatriation Hospital, if you go to Camberfield Ford Vaccination Clinic, the Royal Exhibition Building, Cranbourne Turf Club, Sandown Racecourse, or Melton, all those vaccination clinics have real capacity available for 5 to 11s in the coming days. We'd really encourage parents to use those opportunities to get their kids vaccinated before school starts again, and we move forward. With that, I'll hand back to the Premier for questions.
Thanks very much, Jerome. I'm happy to take any questions you have.
What's the cost of this order?
Sorry, I couldn't quite hear.
What's the cost of this order and how long is the time frame?
It'll be hundreds of millions of dollars, Rich, and you'll, I think, understand if I don't give you a unit price right now. We're still negotiating with people about prices, so we don't want to necessarily signal to everybody exactly how much we're prepared to pay, but it'll be hundreds of millions of dollars, and it'll be brought to book and reconciled in the usual way. And this order will take some time to get here. We don't need all of those 210 million right now, but trying to add to our stockpiles is really important, just as the national government is doing, just as every state and territory is doing, just like everybody across the world is doing, and that does present some challenges. We've seen this all the way through. At these sorts of times, when everybody wants the same thing at the same time, it can be quite challenging. We've seen that with masks, we've seen it with ventilators, we've seen it with all sorts of other equipment. Now we see it with rapid antigen tests, but we've got good supplies, high degree of confidence about those orders that are set to arrive soon, and this order just means we've got that long-term order book, and that gives our suppliers certainty too, that we want. We're not just a sort of a one-time client. We're there for a long-term partnership, and that's really important as well.
Where are they coming from? Are they coming from China?
Principally, yes.
Have you done modelling on how many rats we need a month to sort of see us through?
Kind of depends on a whole range of different issues, like when we get to the peak of this, how many people get boosted and how quickly that happens, the sort of presence of Omicron in our Victorian community, and also whether there's another variant that turns up at some point in the future. So there's a few too many variables to have a definitive answer to that, and it's also, can I say, it's dependent upon a few different policy changes. You know, what's the return to school look like, so on and so forth. So there's a few things that are not quite settled to be able to answer that, but we think 210, so 44 and 166, plus what we've already received and had at the beginning, is enough to get us through, certainly for a number of months. But I think you're going to see us continuing to order for a long time, and we're also working on whether we can manufacture and boost some of the local manufacturing that's already occurring. We're very deeply engaged with a couple of different companies, and we'll have hopefully some very exciting news about that soon as well.
Why wasn't this done last year when rapid tests came on the market? They were used overseas. Why didn't Victoria and Australia jump on this earlier and make bigger orders last year?
Well, we made substantial orders last year, and we received substantial stock. So, you know, ultimately, you respond to the circumstances you face, and you know, if you had taken resources and time and effort away from other things on a kind of speculative approach that there might be a variant turn up that is very, not so bad on critical illness, but really, really transmissible. So if you looked at that kind of a hypothetical, I had no advice to do that. And, you know, you deal with the challenges you face, you prepare for the future as best you possibly can. But, you know, I think you might have asked us quite a few questions if I'd stood here a year ago and said I'd just ordered 210 million rapid antigen tests. But again, we have stockpiles. We've, just like N95 masks, just like all sorts of different parts of our response, we've got sufficient supplies, but we know that we're going to need more. And we're certainly going to need more in the context of this variant. Not Delta, but this variant. And of course, we have to assume that there'll be another variant beyond.
Do you know you can't say definitively when those planes will land? Because you have estimates of when you want to see the total 44 and this order?
Yeah, we certainly have a delivery schedule, and if we can update you on when we can update you on that, we will. Just as last week I confirmed that 3 million had arrived. I've confirmed today that the week to date we've had another 4.5 million. They're out of the 44. We already had several million of these tests on hand to start with. Plus there's this additional order taking us up to the 210 million, and as I've said consistently, we'll aim to provide you with as many updates as we can.
Do you anticipate that teachers and students will be drawing from this?
I anticipate the National Cabinet will have a discussion about school settings today, and that we'll make some announcements very soon. Whether that's today or over the next few days, I'm not quite sure, but there's a power of work going on. I've had many discussions with the Deputy Premier. Him and his team are working very hard, whether it's about the provision of air filters, and we've really done so well compared to, well, we've done the best job I think across the nation when it comes to those air filters. Whether it's school communities reimagining how teaching and learning is going to happen, much more outside, much more open space, getting airflow through as many different parts of the school as they can, as well as some other considerations. There's a lot of work going on, and we're going to be there day one, term one. It'll look a bit different, but it'll be really important. It is really important when you think about our parents have given so much. Our kids have had 2 very challenging years. It's now time to get our kids back into the classroom. That's what we're going to do. I do stress it may look a bit different, and it's not necessarily going to, every part of it will be perfect, but it's really important that we have our kids back day one, term one, and that's what we're working towards.
Just on National Cabinet and on children,
Yes.
there's reports that the Prime Minister wants to lower the age of 4-week licences. Children under the age of 18 will be able to drive them to help the supply engineers. Is that something you've got?
I am not aware of that proposal, and I do know that the only people that really should be driving forklifts are those who are trained and therefore safe to do so. So I want to get advice from WorkSafe and from some of the big logistics companies and others who know about these things before I was to agree to any changes like that. We've got big challenges in so many, that is the state and indeed the nation. We've got so many challenges in lots of different industries. I'll just make the point that with no disrespect to the PM or anybody else, I'm always up for new ideas and being creative, but I've had 2 meetings these last 2 Mondays with all the CEOs of the supermarkets. They haven't suggested that to me.
On schools, expecting remote learning might have to be turned to when there are big outbreaks at schools. Can you rule out that schools can use that?
No, I don't think that remote learning will be a feature of this. I think that we're going to finish up with some kids who will get this and they will be at home and they'll be treated like other kids who would be absent because they were unwell. Hopefully that's for a very short period of time. We're not going to build 2 systems. We're focused on having our system, as we knew it pre-pandemic, have our schools open, have our kinders open, and there'll be different settings. Obviously, just again, without making announcements, because out of respect for National Cabinet, we've got to have a discussion today, and also working very closely with Dom to make sure that the New South Wales and Victorian settings are as close as they can be for every good reason, and I thank him for the partnership that we have on so many different issues. But if you just look at it, primary school kids are in a different position to secondary school kids in a number of different ways. Secondary school kids basically have all had to first dose, second dose, wear masks, I think, and can do some distancing that perhaps primary school kids can't. If a secondary school student is at home unwell, then or needs to isolate because they've got this, you're going to have far less impact on the Victorian economy because many of those kids will be able to spend time at home under different supervisory arrangements than if it's a prep student. Preppies are not first and second dosed in the main. Some of our older primary school kids are, but the numbers are not at 93% like our secondary schools are, so on and so on. So there are differences. It's all one system, but they're different. If we look at our specialist schools that have been such a high priority for me and for our government, we've rebuilt so many of them and changed the way we provide funding and support to parents and students and staff who have special needs. The underlying vulnerability of many within that specialist school system means that they perhaps need to be treated a little bit differently with different settings. By that I mean just extra steps to keep them safe. We want every student back in the classroom day 1, term 1, and we're looking to run one system, not necessarily to be having an online system as well. We're doing our level best to have the system operate as close to normal as possible, but I foreshadow really clearly it may look different. It'll be under a bit of strain because of course teachers are not immune from this virus, so just as nurses are at home unable to work, and AMBOs and supermarket workers and forklift drivers, so too teachers and staff will have already got this, and others will finish up with it. School will look a bit different, but it'll be open and kids will be back.
The Prime Minister has urged the states to sort of loosen rules around workers in essential industries, get back to work for testing. Is that something you support?
Well, we have made a series of announcements about those who are exempt from the ISO rules, and that's had a direct impact. That conversation, those couple of conversations I've had most recently with supermarkets, they had a couple of weeks ago their distribution centres were their real choke point. It's now much more about truck drivers. So the furloughing changes, the direct feedback from some of the biggest employers in the most critical industries to me only a couple of days ago was that the furloughing and the ISO changes that we've made were having a really direct impact. So we're always looking to add additional classes of worker, but you've got to be clear about this, and you want to prioritise because you can add to cases really easily. So it's a balance point. We think we've got that balance right. But our list, Rich, is consistent with, very much consistent with the National Cabinet list that was released last week. I think I had pretty much made all of those announcements, albeit in 2 parts. I made an announcement that morning, and I think Minister Foley had made an announcement on the Monday of last week. So I don't see a massive discrepancy, but we're always up to... our door's open. We're out there listening to industry across the board. Across the board, it's very, very important. We're deeply engaged with every sector whether it's some of the shortages in red and white meat, abattoirs, boning rooms, that whole ag sector, the food sector, where we're deeply engaged with them, supermarkets, big freight companies, all the way through to our role as an employer, whether it be things like people who work in waste management, water, all the way through to Ambulance Victoria, Victoria Police, hospitals. We're engaged with all of those sectors, if you like, and we always listen to them and they provide us with the best feedback.
Given the hospitals are in a complete crisis, was it a mistake to ignore the advice of Brett Sutton and the Chief and his public health team just before Christmas on density limits, dance floors, etc.? It was clear under the new rules that you can't follow to ignore that. Was that a mistake given the crisis we're in now?
No, because a couple of points. One, we're at a point now where, and there's a bit of nonsense gets put around that we've never had regard to certain things. We've only ever been focused on public health advice. That's not actually true. But there are a range of different considerations that need to be looked at. You need to strike a balance. The public health team will always put forward advice that is very much focused on public health, and that's what you'd want them to do. Their job's not to run the economy, their job's not to deal with a much broader framework. That's the job of government, and it's also our job to follow the laws that the Parliament have given us. So I fully support the decisions that were made, and we are open. There are impacts of this variant, there are impacts of this virus. That's why we've extended commercial tenancies. It's why we are out there ordering hundreds of millions of rapid antigen tests. It's why we're doing all sorts of different things. A big team of people, and indeed every single Victorian. Those who are getting a third dose, those who are getting their kids' first dose, those who are in ISO, those who are working longer hours than they otherwise would, those who can't go to work. Everyone's playing their part, everyone's doing their best. But part of that is striking a balance and looking at a broad range of different factors. Victorian community, we asked them to get vaccinated. They've done that in amazing terms. We're asking them now to get a third dose, and those numbers are building. We do want to see more and more people getting that third dose though. And my commitment was that we would be open, we would push through this, as tough as it would be. How many times have I said to you, and I meant it every time, that the months ahead would be very, very challenging for our health system. And on much of the modelling, January and February were always going to be very challenging months, Omicron or no Omicron. But normalising this, getting past it, is critically important. It's also why it's so important for us to thank our nurses, our AMBOs, our doctors, not just in words, although that's important, but to thank them by getting a booster. Thank them by staying in ISO when the rules require you to. Thank them by doing our level best to follow the few but important rules that we have. That's how you honour them and thank them, and it's all about taking just a little bit of pressure off a stretched system.
When you say all those people who are surgery, who are, they need life-changing surgery and they can't get it right now, what do you say to them? They're in pain, they need this stuff. Sometimes it's cancer. What do you say to them?
Well, what I say to every Victorian is that over our time in office, we have worked incredibly hard to grow our health system, to provide more care to more people faster and closer to home. That's why coming into this pandemic we had the best ambulance response times since they started keeping ambulance response times. It's why we had grown the system so that more people, many more people, could get the care that they needed when they needed it. So it's incredibly challenging to have to pause services, to have to cancel services. But if you get advice that there are other sicker patients and the sickest must get treated quickest, and I'm not for a moment, lest there be any games played by some who only ever play games and are not burdened with having to actually be accountable for anything, they just play games every day. And this is not a game. But just so there's no confusion, I'm not minimising the discomfort and the challenge and the pain that is involved for patients who can't get what they need right now. We have provided additional funding. We will, when we get past this peak, We'll continue that effort. We'll do everything we can to get everyone the care that they need and to try and catch up wherever we can. But I just say to those patients, if there was another way, then of course we would do that, consistent with our record. Building the system, new hospitals, more beds, more nurses, more care for more people. That's our record. This pandemic is a unique event. And I would just respectfully say to those who I'm sure are feeling, they're feeling perhaps some, not just discomfort, some pain, but also obviously it would be disappointing to have surgery cancelled. Whether it's the nurses union or the doctors union or so many other clinicians across the board, they have all supported the decision, as hard as it is, to prioritise those sickest patients. It's incredibly difficult decisions to make. They're there for the best of reasons, but we'll get back to hopefully something approaching normal as fast as we can, and that's dependent upon, in many respects, people going and getting that third dose. These are not easy decisions. They're very, very challenging, and they're certainly not easy on those who are impacted by them. And I acknowledge, and I can't be any clearer than that. I acknowledge that this is not easy on those patients who are having to wait.
On the return to schools plan,
Yes.
how will that be announced? Will it be this week or next week? And I only ask because with rapid tests are involved,
Yep.
will there be some kind of mad scramble to get rapid tests, or will they be provided at a school level to students?
We'll make the system as easy as possible. That's not to say that it'll look different. It'll be different than what it normally would be. My only hesitation in not making an announcement today is that there's some discussions that need to be had at National Cabinet. There's some coordination and some partnership with New South Wales, which I think is very important and really valuable, not just for our two states, but for our nation. We'll make our announcements very soon, and we'll be looking to make the system as simple as we possibly can, to make our schools as safe as we possibly can, and to have all our kids back day one, term one. Parents and students, and let's not forget teachers and staff, have given so much. It's just so important that we get our kids back to something approaching a normal beginning of the school year, and we're going to do our level best to achieve that, and I will make more announcements soon.
Are there any situations
To give parents as much notice as we possibly can. We acknowledge that the beginning of school is getting closer.
Are there any situations, Premier, either healthcare or aged care, where staff are permitted to work while COVID positive if they're asymptomatic and wearing the appropriate PPE?
There are. So, for instance, I think I was asked this question the other day. Rachel might have asked me this question the other day, and I made the point that if you're working in a COVID ward, then the fact that you have had COVID and might, on some definitions, be still COVID positive, whether you're infectious or not, that would be another matter, is not such an issue if you're fit and well to do that, and if you've got a mild case. I don't think, we're not seeing that. That's not a widespread thing, but there will be some examples of that. If you've got specifics, or if you want specifics, I can get somebody from the team to perhaps talk to you about that.
What about aged care?
Well, I'm not certain about aged care, and I don't think you'll see that in public aged care, and I'm not responsible for who works in private aged care. That's a matter for the Commonwealth Government. Very much a matter for the Commonwealth Government and the private providers, the for-profit or church and charitable providers who run that system, all 45,000 of those beds. We do about 5,000 beds. The balance of the system is all run by others and is accountable to others, not to me and our government.
The TGA have approved Novavax vaccine. Is Victoria ready to go to start distributing that?
Obviously, we respond to all TGA approvals, and it'll be about how much stock is here, and I'm not sure. We're focused on delivering what's on offer now. I'm not sure what that'll look like, but we'll look at that. It may well be that perhaps primary care picks that up more than we might. We wouldn't go and change all of our systems to introduce a new vaccine, but I look forward to. We've all had someone tell us they're waiting for Novavax. Well, it's here now, so I'm looking forward to those people going and getting their first, second, and then their third doses. It's wonderful. It's terrific.
Yeah, a lot of people I have heard said the same thing. Do you have any data on whether
I don't.
our vaccination rate?
I don't have data on that, but I think we've all heard people speak in those terms, and it's terrific that the product they've been waiting for is here.
On ice creams,
Yes.
can you say how many will be available, how much
No, and I won't also be going through how much it'll cost for us to hand out bottles of water. Like seriously, seriously, it's going to be a hot weekend. We're having a blitz. We're encouraging tens of thousands of people to go and do something not just for themselves, but for all of us. And we're going to hand out some ice creams to people if they want one, and we're going to hand out bottles of water to people if they want one. And it'll all be brought to book when we reconcile all of our COVID-19 spending. I think an ice cream or a bottle of water is a very, very small thing to do. The big thing that's going to be happening on the weekend is not that a few ice creams are going to be handed out, is that people are going to come forward in massive numbers to get their booster shot. That's what's really important. I don't know, some people are so negative. It's a positive. It's a hot weekend. We're going to support people who are standing in queues. Because they're not just standing in the queue for themselves, they're standing in the queue for all of us. So I thank them for that. And it's a modest cost. I think it's a Victorian product, and it's a small thing. The big thing that's happening is the number of people who are getting a third dose.
I mean, why did Andrew Bogut receive a threat of a fine from the Electoral Commission for posting negative?
I'm not really a follower of his social media, and those matters are a matter for the Victorian Electoral Commission, as they should be. The Electoral Act is administered by the VEC, so you'd need to speak to them. The first I knew of that, and I haven't spent a lot of time thinking about it, let me assure you, was when I was on the front page of the paper today.
On schools, Premier, Victorian schools are already reporting teacher shortages, especially in Melbourne and
Yep.
North and West.
Yep.
How do you plug those holes? And if there is an outbreak at a school such as one that's already got shortages, how are they expected to keep teaching in the class?
You do the best you can. That's what we're all doing at the moment. That's what every Victorian's doing. And just as nurses and ambos and doctors have got this and can't go to work, there'll be a whole bunch of teachers. And let's never forget, there are educators in our schools, but then there are support staff, and their work is just as important. There'll definitely be impacts. Right now, there'll be people who probably won't, based on their status right now, won't be able to be at work in a week's time. Let's just wait and see how that goes. We've got a plan to try and cope with that, and it'll look a bit different, and we might see some people teaching classes that they wouldn't normally teach. But again, all of that is, I think, is secondary to the main aim here, and that is to have our kids back in the classroom as safe as we can on day one, and then we will manage those risks as best we can as we go forward. I can't make an announcement today, but I don't want anyone to think there's not a power of work gone on. There has been. We're deeply engaged with this issue, and indeed in a very strong partnership with New South Wales, and we'll have more to say as soon as we can.
Premier, some Australian Open tennis players have expressed concerns there might be more positive cases amongst the players out there. They're just not being picked up because the testing scheme there isn't rigorous enough. Do you have confidence in Tennis Australia's system?
I've not seen those reports. I'm doubting them, but I haven't seen those reports. And if you want a detailed account of Tennis Australia's testing regime, you'd probably need to go to the TA for that. In all the engagement that I've had with Tennis Australia, they take issues of infection control very seriously. Last year, year before, this year. That challenge has changed a bit, but they want to run a safe event. They want to run a really successful event, and it's off to a fantastic start.
Just on the tennis, there are reports that Tennis Australia paid the legal fees of Novak Djokovic. Are you aware of those reports?
I have seen those reports briefly this morning. I can't comment on that. You'd have to speak to Tennis Australia.
But would that concern the government if that's how Tennis Australia was spending money? Tennis Australia's borrowed money from the government in the past 12 months.
I don't necessarily think for those purposes, but Tennis Australia's a pretty big outfit, and they can make their own decisions and they can be accountable for them. But I'm not going to go over every dollar that may or may not have been spent by Tennis Australia. They really have to answer that question first, and then they can account for it.
And following the change to IVF, do you know what other services?
Yes, that's a very good point. Sorry, I'm not sure if off the top if I mentioned, but there's a number of other day procedures because, as I said yesterday and again today, the advice we get is very, very conservative, and it's kind of worst case. And then if you can put things back into the system, Maybe they look a bit different, maybe they're modified, but if you can then add back in good time, like it's only been about a week since some of these changes were made, then you absolutely do that. So I hope, because I've asked, and I think I know there's a process going on at the moment to review the advice in a number of other day surgery and day procedures. So hopefully I can make some announcements, or the Health Minister can make some announcements next week and add to that list. You know, no one wants to have anybody wait longer for their care than is absolutely necessary. There is a principle that guides our public hospital system, and that is that the sickest patients get treated quickest. And every one of us benefits from that. If it's us that needs that care, if it's us that is time critical, life and death, there's a lot of strain in the system. The staff are doing the best they can. I obviously regret any disruption, but this is a unique event. It's a 1 in 100 year event, and the best thing we can do is get boosted, get past this peak, and then get these services back on. And hopefully I can add to the list of day procedures in the coming days.
Are you pleased that Kelly Slater has been told well in advance that he won't be allowed entry into the country unless he's vaccinated?
I think that it's important, let's not get into the personalities of these things. I think it's important that there's clarity from the Commonwealth Government about who gets in and who doesn't. So that is a good thing.
Have you been speaking?
Lest you have like a kind of soap opera drama, you know, that wastes everybody's time. I made my views clear yesterday. Tennis is bigger than any one person, and we're seeing that down at, whether it's at any of the venues down there at Melbourne Park. Crowds are there, and they're seeing world-class major event, and that's what it's all about. Not any one person, and I dare say that, you know, Bells is just the same.
Have you been speaking to the World Surf League about having an accession process similar to Tennis Australia?
I certainly haven't. I'm not sure whether Visit Victoria or others might have been engaged with them on all manner of different issues. I'm sure they would have been talking to them because it's a big event, and it's one that we support, I believe. I can't quote for you exactly how much we provide, but I'm pretty sure we do. So I'm happy to try and come back to you on that. But that's kind of a moot point, because the Commonwealth Government have been very clear, clearer now than they have been for a while, which is good. It's very good.
In devastating news, Harry Styles has cancelled his world tour here and come down to Melbourne. I know, so playing great news, sad. And plenty of other.
It's going to be big on 7 tonight, it seems. Chanel's very upset. There you go.
Veronica's have cancelled their tour as well, which is also sad. Are there any plans to throw a lifeline to the entertainment industry or these big events? Because clearly it looks like they're falling like dominoes.
Just composing myself. Good. Look, this pandemic has disrupted events across the whole world. Now, it's funny, we talk about the tennis, but Rod Laver Arena is one of the top 3 or 4 live music venues in the world. So it's not just there for the tennis, it's there for so many other events. This is unprecedented, it's very challenging. This industry's given a lot, and not just those who perform, as important as they are, but all the roadies and crew, all the support team. It's been a tough couple of years. We will get to the point, I think, where we're much closer to normal than we have been for a long time. Hopefully that comes soon. But we've worked to support this industry, and the good thing about it is, when you're in Melbourne and Victoria, the live music capital of our nation, you've got lots of homegrown talent who don't have to necessarily travel around the world. So I haven't heard that the Alls have cancelled. They're coming in March, I think. So that's the one I'm most focused on. No disrespect to anyone who's focused on others. Any other issues? Very good, thank you. Have a good day. Sorry, who? Oh, no. London Grammar's in February. London Grammar in February. That's my household interested in that. Yeah, we'll just have to wait and see. But we all get boosted ASAP, then there'll be less of these. More concerts and less cancellations. Thank you.